In this session, we'll be talking about recognising barriers to patient success and how we overcome them. We'll be fortunate to speak to my own father, Geoff Whitington, about the journey we went on with him, and also to Dr. Scott Murray, consultant cardiologist, who will be talking about avoiding the path to heartbreak. Let's have a look at Fixing Dad, the cardiologist's perspective, which will give a really good overview of this session.
There we go. Anything else for me now?
Hello.
You all right?
All right, how you doing?
Yeah, I've just been to see Dad, and he's just getting worse. It's just not good.
I know
Really.
he is. I know.
So I think we need to get together and do something.
But where the hell do you start?
It was behind me all the time, but I didn't really realise. I didn't know that I could be close to a heart attack or stroke or anything like that. I wish I'd been told back then. I wish I'd known. I just carried on how I always had. You always knew, you heard about people with heart attack. I just thought that was something that you either have or you don't. I had to scare myself by seeing what was going on and then realising that terrifies you. It's not just an illness. These things are there in the background and you need to look at them. You need to get them under control. And you can do it. You really can do it. I know that now. I know you can beat this thing.
Health is wealth. You know, you haven't got a dime if you don't have your health. We're living in a multi-morbid world now. There's not just one condition, it's multiple conditions you're having to unpick. Humans naturally won't change until it's right there. That's when they'll change, and that chance to be there at that time to influence them is rare.
Right, it's now 2 o'clock in the morning. I'm completing my chores around the building. Slightly out of breath now.
Templosing, metformin, glycoside, warfarin, statins, atenolol.
Yeah.
The problem is when all these things come together, isn't it? Who is looking at the whole picture?
What is the problem with his heart?
Geoff was the poster boy for metabolic meltdown. Blood pressure was over 200 systolic, and he had atrial fibrillation, he's on warfarin, so he's already got macro and microvascular complications. You know, if we had put Geoff through the ringer at that point, we would have found quite a lot of abnormalities. I suspect that his cholesterol would have been raised. You know, there would have been talk about going on a statin. I reckon we would have found some abnormalities at the liver level, at the coronary artery level. The next step was a full-blown heart attack or stroke, without a doubt.
Perhaps I was thinking of downsizing a little bit later on and having a bit more money there.
It's not later on, it's with a line in the sand, it's now.
Yeah, but yeah.
There is no later on. That is the problem, isn't it? It's, you know, you just keep going and keep going and keep going until suddenly it's not doable anymore.
Doctors don't really want to upset patients, but I think patients need to be upset to make a change. I don't mean that like I'm shouting and crying in the consultation, but they need to know that this is real. This could mean something drastic down the line.
Everything from cancer to heart attacks to strokes to dementia to amputation to kidney failure to blindness, impotence, it's all going to be much more likely. Unless we fix this, you are driving right next to the cliff. Where previously you were in the middle of the lane, you've now got a wheel half over the ditch, and it doesn't take much to push you.
I just really feel like it's someone else has got to do something. He's a fantastic dad, he's been a brilliant dad, and he's a brilliant granddad. And if we don't do something about it, no one else is going to.
From Geoff's perspective, the continued elevation of your blood sugar, as soon as you're going above sort of 7, you know, cardiovascular disease is guaranteed almost. The biggest impact that we have on patients comes from the consultant cardiologist, you know, especially at the time when the stent goes in. Prevention and rehab is not optional. You know, this is what needs to be done to stop them coming back. And sometimes you feel a bit as if you're drowning and that you're never going to be able to do the right thing. Ultimately, you just have to follow the guidelines. Yes, it's good to know about imaging the heart and echo and putting stents in and devices, pacemakers, all those other facets to cardiology, arrhythmias. But if you want to stop people from getting there in the first place, you've got to embrace prevention. I think that more thought has to go into what the patient actually wants themselves. Ultimately, everyone who's in this sphere wants the same thing. We all want patients to get better.
And I think it's just I start to think about all the things that, you know,
What?
well, that you're going to leave behind.
No, you don't need to think about that yet.
I think we're looking at a world where at younger ages people are going to be pitching up with heart failure because they've got diabetic physiology, hypertension, atrial fibrillation, stroke, heart attacks. It's going to rise unless individuals start realising that what they ingest and what they do day to day actually matters.
We know he's stubborn.
I understand what I need, but I'm not going to be doing it. So what's the problem?
You're always 100 miles an hour, you just got to calm down.
Who's talking?
Once he sticks his heels in, that's it.
I don't enjoy cooking.
You do though.
I don't enjoy it. I don't enjoy cooking.
5, 6 people who come into my clinic on a Tuesday morning will be Geoff.
You have me running up and downstairs with my heart going like 20 to the
Yeah, we have to.
dozen.
That's part of saving you, isn't it? Otherwise you'd be lying on your back eating whatsits.
It's such a moving thing when you think about the dads that haven't been fixed. If you could only just take a snapshot of that final moment when someone dies from something that could have been prevented. If you can only take that snapshot and show it to people, this is what happens. It's like a shock.
If the boys hadn't done this for me, then there's not a way in the world I would have achieved any of this stuff that I've done. They did things with me, they checked everything, they keep on top of things. It made it possible and doable. When my sons first started taking me out on the bike and trying to get me to do things, I was sort of almost taking it as a bit of a joke, really.
I must be complete. Start raving.
He's agreed to it.
Okay.
If you could get prevention and rehabilitation right, we know that there's rapid improvements. It's the same as population level prevention strategies. It's rapid improvements.
I would never ever have contemplated even trying. The loss of feeling in my fingers and toes, I mean, that's your warning. You're getting that numbness. This is happening to my body. It's going to stop certain organs in my body from working.
Occasionally I see the penny drop patients.
This is absolutely glorious. It really is. Oh, it's fantastic to do.
They leave with more hope or a bit of a glint in their eye that, right, I know what I have to do now.
Right, we've got raw frittata for dinner because nobody can turn the cooker on. What have I done? Help, help.
It really isn't a sentence to a future dull life, believe me.
They go away and then they come back 4 months later and they've lost weight and the bloods look better and you say, see, you could do it. And I think that's something that's really motivational, is activating a patient.
I've got a far better life now than I ever had, and it's only through doing what we did and doing what the boys did for me and changing my lifestyle. In a very short time it became more than that. It became something that I knew was making my life better. I was going to do it, and my God, I'm so glad I did.
Hey! Yes!
You see the rapid changing, and during the documentary you see his energy levels go up, you see the weight coming off him, his mood goes up. The key message is that if you've got the right support, if you've got the right information, and you can make the right choices, you can revolutionise yourself. I think any human being could do that in that situation.
It's a truly shocking and horrible statistic, isn't it? 300 people will have died from a heart attack or stroke just in those 10 short minutes. But what you do today can make a difference. And as Dr. Scott Murray says in there, it's activating a patient that's so important. That film is obviously so personal to me for many reasons. Fixing Dad represents some of the best and most worthwhile years of my life, but the significance of that message just can't be understated. Dad, what is it you'd like to say to people who might be heading for these kinds of health problems like type 2 diabetes or cardiovascular disease?
Well, all I'd say is that, look at that, it was 6 years ago this started for me, and believe me, at that time I was of that sort of attitude. There's no way that I was going to be able to do anything about it. I was at the lowest level in my life. Everything around me was falling apart, and I knew it was, but there was nothing I could do. It was just the way life was, and it was the way things were going to happen. But just realising now that just getting hold of these things, one thing at a time, you can get on top of it. You've got to take control. You need to be able to be in control. You've got to understand what's happening to your body. And I think that's what it is all about now. It's about monitoring yourself. It's about keeping an eye on what works for you. It's not all about just having a silly sort of diet, silly salad diet. It's got to be what works for you. And I think everybody I talk to now in the same situation, they see the film and they all say, well, I don't think I could do what you've done. And I tell them, yes, you can. It isn't what you're thinking. It really isn't. My life has totally turned around. I wouldn't be here now if it hadn't been for this. I know I wouldn't be. But I'm having the best time of my life, and I know I've got more years to go, more years to come. And I'd say to anybody, just get people around you, get the people you need, get your healthcare professionals to talk to you. Just make the effort and make a project of it. That's the biggest thing. You can tell yourself, this is going to work. I can do this. And it doesn't take very long before you see those results. They really do start coming through, and your life turns around completely. And that's what it's all about. It's getting hold of your life and controlling it. And you can do it.
Something we're always saying, because obviously Fixing Dad is now, it's become Fixing Us, because we work with so many people. And what we find is that when they start, helping themselves, they start to help the people around them, and it has a knock-on effect through the whole family. But I mean, what would you say? We always said the key to this is what Scott said in the film there. It's about, activating patients. And when you activate a patient, there is this great feeling for healthcare professionals. So it'd be a lot of healthcare professionals watching this. What would you say is the key to that? What would be your advice to a healthcare professional?
I think it would be to... you always say that you shouldn't scare a patient, but I honestly believe that you need to be told what the truth is. You need to know exactly what is happening to you, especially when you're diagnosed with diabetes. You've got to be told this isn't just about eating the sugar, which is what most people think.
This is about what's happening to all your organs, what's happening to your heart, what's happening to your kidneys, your liver. Everything is being attacked by this thing. Just tell them, let them know, but let them know you can do something. It is manageable. You can get hold of it at any stage. You can get hold of this thing. And I realised just from seeing all the other people that we work with, that over a very short period of time, you can take control of this thing. And you just got to be got out there. We've got to let people know you can do this. With the right help, you can do it.
So what do you think was the moment when the switch flicked for you, to when you actually became engaged rather than just a passenger on the journey?
I don't know. I think initially when you started on the project and you started talking to me about going out on a bike and cycling 100 miles, it was all probably quite a joke, really. I couldn't, there's not a way in the world I was going to do anything like that. But I could see what it meant to you, and that made all the difference for me. It was having you behind me. It was getting all the information from the right people, and then realising that I was actually doing something myself to make a difference, and that this could totally change my life, and it has.
So obviously this is something that I know at the beginning you didn't know, all the things that type 2 diabetes could have led to. So what do you think, and I know you obviously realised the having the foot and the risk of amputation, that was a big risk there, but what do you think's changed now in your understanding of that, and what has it done for you in terms of keeping you on this straight and narrow?
I think it made me realise that when I look back at that time, I was getting the indications. I was having all sorts of different things. There was the AF was there. I didn't know it was atrial fibrillation, but that was there, and I could feel it when I was in bed at night, and I could feel my heart sort of missing a beat, and I was getting tingling in my fingers and my toes, and I learned later on exactly what was causing it and why it was, but I didn't know at the time, and it didn't worry me particularly. It wasn't anything I thought I needed to do anything about. Shortness of breath, I'd only have to sort of get up off the settee, and I'd feel as though I've done a day's work, and little things like that were obviously indications that I didn't really. It's obviously out there. I know I was being told by diabetes people by that time that this is what I've got to watch my diet and things like that, but you don't put it together yourself. You don't make the picture in your head of what this thing is doing to your body. And I think it's when you reach that point and you start to realise, I can do it now even. If I should actually eat something that's a bit high in sugar or something I shouldn't be eating, I do literally feel the tingling in my fingers even more. So straight away I've got an indication. And with the blood sugar monitoring as well, making sure you're watching exactly what this stuff is doing to you, you know what works for you. You can take control at that point and really change what you're doing. And it isn't about eating all the salads and everything else. You'll eat what you need to eat, and you'll enjoy your food.
Yeah. I mean, one of the real illustrations of that was when you, me, Andy, and we were all taking our blood sugars, weren't we? And we all had totally different spikes, totally different readings for different foods, for the same food rather. So it really is a personal thing, and at that point it becomes your own health, doesn't it? It becomes your own project.
Very much, because you understand.
So, I mean, yeah, exactly. And so going over to Scott, so Dr. Scott Murray, consultant cardiologist, was in the film there, and Scott, you talked in the film there about actually lots of people come in and present exactly the same conditions as Geoff, and in fact they're very, very similar. So talk to us a bit about that and avoiding the path to heartbreak.
Yeah, thanks, Andy. It's basically like a conveyor belt in the clinic, because I just know more what I'm looking for now. I immediately go straight to the HbA1c or the glucose measurements we've got on file. Immediately go to the cholesterol and triglyceride and HDL results, and I immediately ask the patients, roughly what they weigh, because a lot of it is telephone conversations now. So in a way, I can have the conversation more freely by saying, I haven't seen you, but how tall are you and how much do you weigh? So at that point, I already know roughly what we're dealing with, but it is literally a conveyor belt of the same patients that, they're breathless, and they've got diabetes, or they've been told, oh, you've got pre-diabetes, which I have to say is one of the, most annoying things that I come across is, oh, you've got pre-diabetes, we don't need to worry about you. We'll put you on the pre-diabetic register, not the diabetic register. And I'm just thinking to myself, one can of Coke and this person is diabetic that day. And the sheer fact that the HbA1c is a test of your mean blood sugar, your average blood sugar. So your blood sugar could be 10 for, 5 times a day. But your blood sugar could be 4, 6 times a day. And when you add all the 10s and the 4s up and you divide by the number of times it's gone up or down, you get maybe 6 or 7. And that's what your mean reading comes out. And it's, oh, you've got a bit of a touch of sugar. Whereas, every time you eat, your blood sugar's going to 10, 11, 12. And that's just, that swing out of range, those glycemic variabilities, as we call them, is not good for your internal physiology. It's trashing your vasculature, it's upsetting the endothelium, it's not letting your kidneys do the job properly. It's extra, calories and energy that you probably have got nowhere to put. So nowadays, I just say to people, you've got to start with what's going in your mouth and what you're eating. And again, the same thing comes back. What do you have for breakfast? Oh, I have cereal or porridge. Okay. What do you have for lunch? Oh, I have a sandwich and some crisps. Okay. And what do you have for dinner? Oh, I have pasta with a sauce and, and then I'll have a pudding. And, human beings don't actually need to eat 3 times or 4 times a day and have snacks in between. We actually probably need, much less than that. And I think because you're hungry all the time, if you're in that paradigm and you're conditioned to eat in that way, you are just going to continue to eat that way.
So what do you think is the biggest barrier, and how do you actually get hold of patients on this and make them realise what needs to happen?
So what I use the David Unwin technique, which is I try to give them a bit of hope, and I try to say that if they can get control of it, then there's no reason why they can't take it forward. And I just say many people are reversing or putting their diabetes into remission now, and that will have multiple implications for your blood pressure, for your heart arteries, for your kidneys. All of these things are going to benefit. So I tend to say to them, have a think about what you're eating, and before you eat it, think, is this going to digest down into sugar or a glucose in my body, and is this going to potentially spike my blood sugar? And the things that aren't going to do that tend to be your sort of real, they say real foods in inverted commas, but foods that are high in protein and healthy fats. That's not going to spike your blood sugar, but it's going to satiate you, and it's going to make you feel like you've had some decent food. And it probably contains more of the nutrients and vitamins and micronutrients that you need than so-called foodstuffs like croissants and bagels and buns and biscuits and, breakfast cereals, which are, let's face it, fortified for a reason. And so I start with baby steps with them and say, well, why don't you just change what you have for breakfast and, maybe have some scrambled eggs and see how you get on and test your blood sugar. And then you might not need to inject your insulin if it's not gone too high. And then maybe move to the next meal and then say, well, what are you going to have then? Maybe if you had some chicken on its own with some, cucumber or salad or something green, then again, your blood sugar might not rise. And I think that's just getting that information across. You can eat things that will still be tasty without, it having to be with bread. Because a lot of patients are eating half a loaf or a loaf of bread a day, and you're like, this is not going to end well.
And how much of this is the kind of, support network at home, the person that's doing the shopping, those things? How influential is that in your book?
Very, because if it's there or it's in the cupboard, it will get eaten. So if someone has a treat drawer, or there's a little cubby hole for crisps or chocolate or treats or whatever, it happens in our house. You see people opening cupboards looking for a random jar of Nutella that might have a scraping of the internal contents left that someone can spoon out. So I think it's about being mindful of, when you're shopping, right, I'm only going to get stuff in that's protein, healthy fat, nutrient dense, and trying to do that on a budget can be difficult, but it's not impossible. You can get excellent cuts of chicken and fish and meat if you're that way inclined, that you can cook and slice up and freeze and do all sorts of things with. So I think it's about being mindful that if someone gets a 10 packet of Kit Kats in, then they're going to be there and they're going to be eaten.
Yeah. Now you've sort of set out, I guess, haven't you, as a preventive cardiologist? Would you say that? Is that fair to say? Do you think there's sort of different approaches in your work?
Yeah, I mean, I think I just got a bit fed up seeing the endless conveyor belt of people coming in needing stents put in the middle of the night. And when you actually take time to speak to the patients after the procedure, you find out that they don't drink water; they just drink full-fat Coke, and they're living on chicken nuggets and crisps and things like that. It's interesting when you start delving into the root cause, but often it's not just food; it's the stress, the social environment. There's poverty, smoking. There's lots of facets to this. I mean, we tend to focus on the diet, but the diet is really just one thing that you can action, along with other preventable risks. But I just got fed up seeing that and decided, and also got fed up getting up at 4 a.m. with a young family. So I think it was a change in my mindset, and I was just about to take on a role with prevention and rehabilitation in a national role. So that's when I changed tack and have been focusing on that ever since.
Yeah. So I mean, it's interesting what you're saying as well about the the people in the house, or the caregivers, in terms of how they become so instrumental. I mean, obviously our story was a sort of extreme version of that, because we gave our dad complete care, if you like, for a long period. Having said that, we weren't in his life quite as much as the film suggested. It was more of a couple of times a week, and phone calls and things like that, but just sort of tracking how you were doing, wasn't it, and looking at the blood sugars and looking at your cholesterol and all that stuff. And Graham, it's probably a good place to bring you in. So Graham Addison from AstraZeneca, just in terms of why you decided to support this project, the Fixing Dad, the cardiologist perspective.
Yeah, thanks, Anthony. First of all, I would just like to say it has been an absolute privilege to be able to work with Geoff, with you, over the course of this project, and of course on previous projects, and yourself, Anthony and Ian. And you really are an inspiration. And I say that very genuinely. Personally, I've seen that, through our organisation, and of course out with that in a public setting. So that's the first thing. I think secondly, I would say that the reason I wanted to get involved in the project is that knowing, the backstory, I guess, with Fixing Dad and the original story, and certainly within my role, we're very much focusing on the cardiovascular therapy area, and the thing that was missing for me out of that story was I guess the narrative that Scott so eloquently added to it. What does this actually mean from a cardiologist's perspective? And it really highlights, you don't need to dig too deeply into the numbers. Unfortunately, we're living in a world where 18 million people die every year from cardiovascular disease, and 85% of that will be attributed to heart attacks or strokes. So there's certainly a role there for us to play in raising awareness, of course, in relation to that, and the unmet need, but of course not just raising awareness, ensuring that we all work together to do something about it and to support patients to achieve the best possible outcome. So for me personally on the project, I had two jobs to do in relation with the film. Our organisation, as you can imagine, is rather large. I think in my last count there was about 74,000 employees across the organisation, and I had a job to do to, I guess, inspire, motivate, and engage the organisation behind, the unmet need, if you like. And as you would expect with an organisation so large, not everybody knows everything that's been worked on. So the ability to utilise, a really inspirational and emotional story like that really helps us to unite, I guess, and come together behind a common cause. And then secondly is actually be able to which is really the really exciting part for me, is to be able to get that out there into the public domain, and share it equally with healthcare professionals and members of the public. And I think importantly for me, especially considering what we've just been through, all of us have just been through in the past year, it's critical, that people still talk to their healthcare professionals. And I know that we've seen a real impact in that across many countries in relation to admissions to A&E, for example, or admissions to hospitals in a secondary care setting. People just weren't turning up, in the first part of this year, certainly, which had a huge impact on health outcomes. And I guess, for me, it really does, put the onus on the patient, as well as inspiring, informing, and motivating them. I'm a very firm believer that emotion leads to action, and that is definitely something that I hope you get a sense of when you watch the film. Really, it really is emotive, and that comes down to the beautiful way that you tell the story.
I think this is it in terms of the engagement. We always said that there had to be a sort of balance between hope and fear, I guess, and it's the same right the way from diagnosis of a condition right the way through to. But I think you often see, in the way it gets dealt with, even if you just Google the term, type 2 diabetes, or cardiovascular disease, you get all sorts of, pretty negative stuff. But if you look at actual success stories, or you look at reversing or improving type 2 diabetes, you get a totally different. So it's all about what you're looking for, and the backdrop, I guess, with what we saw even in the healthcare profession, Dad, the different ways different doctors talk to you about it. It was such a sort of disparity. So it's trying to get, I guess it's trying to unify and through that emotion just sort of show that there is something we can all unite in, and it is that hope that there is. You can improve things. It doesn't have to go down that way inevitably. I think that comes across in the cardiologist perspective, definitely.
Very true what you said. There's so many different healthcare professionals out there that deal with things in different ways, and it is a case of finding one that really understands the way it works for you. That's the thing. We're all different. A lot of the people I speak to that suffer with this, and they've seen the film and they love what we did, but they couldn't see themselves doing it. It's because they haven't got that support. We had to change their doctor. At that time, it was a totally negative attitude that I was getting with regard to it. I'm not saying it's their fault. It's my attitude as well. I was willing to accept everything they were telling me and just going away and getting on with it and then just carrying on. But I think there's a lot of people out there that aren't willing to give you as a patient the opportunity of explaining what's happening, or explain to you what's happening, and that there are things you can do about it.
And it was interesting, wasn't it? I think this is where just the process of making the film came in, and we didn't realise it was going to have that impact. But because we were coming along to your GP appointments with you, we were actually saying, you were accepting stuff, and we were saying, no, hang on, don't understand that. Why can't this happen, or why can't that happen? So we got a referral to a cardiologist. It was a private appointment in the end we had to get, but we managed to do that. So we got that sort of perspective, and then there was the whole. The blood sugar monitoring, so they weren't even going to probably, potentially continue your blood strips, but instead of that, we started you on constant monitoring, and so that, it just changed everything, I think. And if everyone, it makes you wonder if everybody had that sort of healthcare advice behind them, or they could be that proactive. then you probably have very different outcomes, because people will be seeing the right specialists and will be, able to take the right steps themselves as well.
Yeah, because most of the people I do speak to, they literally their doctor is God. They told them they've got to do something, and that's it. You don't question it. You don't. There's no sort of reason to ask. My mum was a typical example. The doctors told me I've got to be on this, so that's what I'm going to do. I'm going to take those pills, but never to look at why she had been put on those pills in the first place. What had caused her to be in that position, and this is what everybody or a lot of the people I talk to seem to think. They think, oh no, I'm being looked after, it's under control, but they don't ask why. Why are they in that position? And that's what's wrong. I think it needs to be this discussion with the healthcare professionals to say, how can I change this? Is there something we can do or I can do to change this myself? And that needs to be got across at the doctor's appointment, basically.
What you've just described there is something called life stage segmentation, which is a thing that was actually a big document released by the Department of Health on this, and you've described the difference between being a health conscious realist, i.e. you can understand health terms and what you need to do in order to keep your health going forward, and an unconfident fatalist, which is the majority of the population in Northern England, in certain areas. They just don't have health literacy, and they don't question anything to do with the health, and health is quite low down on their priority. Now, if anything, the COVID pandemic has maybe upped health in some people's priorities above, we'll never be above football and, sport and things like that. But certainly, actually being able to think about your health and how you keep your health or improve your health is something which we need to start probably educating primordially, which is in schools and in secondary schools, about how do you maintain your metabolic health going forward. But that's a whole other conversation.
What's your advice, Scott, to primary healthcare professionals in terms of, how do you use a very short appointment slot? I think in the UK it's 8 minutes. What would be your advice in terms of how to use that best?
Well, I mean, I think if it's related to someone's, general metabolic health, cardiovascular health, you've got to take the blood pressure and, maybe dip the urine and look at the blood results in terms of the HbA1c, and the fasting glucose is a very good measure, because if you've got fasting dysglycemia, then you're on a slippery slope already, even though your HbA1c may be normal. If you've got microalbuminuria in your dipstick, or you've got sugar, then you already know that the kidney's not the kidney's struggling to deal with what's been thrown at it. Can go into that a bit in the presentation, but I think it's about saying, look, this is real. This is going to cause long-term issues. You're on the path towards heart attack, kidney failure, liver disease, amputations. The way to act is to really cut back on what's going into the fuel tank and empty out what's in the general super tanker to give some space. Because we know that the problems come when you are glucotoxic and lipotoxic, and what that means is your body's got nowhere and no ability to get rid of the excess sugar in the bloodstream, and it's struggling to store fat. So fat is leaking back out of your fat cells into the blood, and that's got to be put somewhere. So your body has got a storage problem. You're energy toxic. So if you start saying to people, your sugar bowl's full, your energy bowl's full, you need to cut back on energy, you need to cut back on sugar and starch and general your calorie intake, and that you need to start eating as healthily as you possibly can in order to reverse this. And there'll be a whole myriad of benefits that will come by doing that. Your blood pressure will improve, your kidneys will be healthier, etc., etc. So I think it's got to be hard hitting though. Because if you just say, oh, you got a bit of touch of pre-diabetes, a bit of sugar, off you go, don't worry about it. You know, because I think that people in the UK, we don't want to upset patients. We don't want them going away worrying that, you know, because that can be a difficult thing. But I think you do need to, I say it in the movie, I think you do have to make people worry for them to take action. Emotion causes, and what was it you said? Emotion causes action. That's quite a good term.
Yeah, absolutely. So do you want to, it's probably a good idea, actually probably leads into your presentation quite well there, doesn't it?
Yeah. Okay, great. So this is the Preventing the Path to Heartbreak. I've called this talk just because heartbreak in the personal sense of the word is normally related to, you know, someone you love or something that's happened. But the heartbreak that I see day in, day out is because people's hearts are either failing or having a serious issue. So I'm going to jump straight in. This is a slide from a work I did with Liverpool City Council about why people die from cardiovascular disease. And you can see on this chart, it's taken from the Global Burden of Disease study in 2016, but this is Northwest England. And you can see that high blood pressure, dietary risks, high total cholesterol, body mass index, tobacco and glucose with low physical activity are the main things that we can have an impact on in our own lives, which could lead us to die from cardiovascular disease. So why does this happen? What I see a lot of is people say they've got a family history of heart disease, and that can be a genetic, primarily a genetic thing. But I do see a lot of environmental family cues and habits that have crept in as to how people believe that they should act and what they should be doing with their life. And sadly, the majority of it is preventable. In 2004, Salim Yusuf released a study called InterHeart, and it was a groundbreaking study, but it was ignored in some parts of the medical world. But it did point to the fact that there are 9 risk factors which are accountable for greater than 90% of the population attributable risk of heart attack. MI is heart attack in these slides. And you can see there that it boils down to the same things. It's diet, obesity, diabetes, blood lipids, lack of exercise, smoking, high blood pressure, excess alcohol. And this is genuinely 80% preventable. If we look at the next slide, this shows that the main risk was driven by this lipid marker. And it says here ApoB over ApoA1. And what that means is all the bad lipoproteins, so all the bad carriers of cholesterol in the blood, divided by all the good carriers of cholesterol, all the type of lipoproteins that are able to regenerate or take bad cholesterol out of arteries and places it shouldn't be, was the highest risk. Not total cholesterol. This is a different metric, but this is how we got into the paradigm of thinking that cholesterol was exceptionally important. And you can see on this chart that as the ApoB over ApoA1 ratio rises, the risk of a heart attack rises, and it's almost linear. So I wanted to drop in the fact that many people I see have the phenotype and bloods which show that they are very likely to be insulin resistant with high levels of insulin, so hyperinsulinemia. And you can see from these two tables that if you look at this between people who are genuinely sensitive to insulin and metabolically healthy versus people who are resistant to insulin and requiring a lot of insulin to deal with what they're hitting their body with, there are huge differences in the blood lipids, including ApoB, HDL, LDL, which are different types of cholesterol carrying lipoproteins, and they've got huge differences in their blood pressure and their insulin, and it's the same across men and women. And we see that as this ApoB1 over ApoA1 ratio rises, the risk of, not only the risk of heart disease rises, but it is a marker that you are insulin resistant. And control of cardiovascular risk factors that I've just spoken about is very rarely achieved. If you look here, the average in obesity, people achieving a BMI and a waist circumference goal is actually 3%. So we've got a lot of work to do here, and it's probably because people are not getting the right advice. This is hyperinsulinemia that is causing all of these risk factors. And we know that hyperinsulinemia is an independent risk factor for heart disease. We've known that since the mid-90s. So moving on, here's quite a provocative slide of a healthy heart on the left-hand side and a very unhealthy heart on the right-hand side. Now, I say this is a healthy heart, but it's on the slab, so it's not technically healthy. It was taken out of someone who did not die of heart disease. But you see the heart on the right with lots of lipid and fat attached to it, and that is an unhealthy heart surrounded by what we call visceral fat. This is a patient of mine who agreed to have his photo taken. He was breathless, and you can see his tummy here, and that tummy was quite hard, indicating that his fat cells were pretty filled up, and he'd maxed out his subcutaneous fat threshold, so he'd stored enough. And when we did his echo report, it showed that there was a global layer of fat around his heart, and his heart was struggling to relax. This is called diastolic dysfunction, where the heart pumps okay, but it doesn't relax well, and we're seeing more of this. And if you looked at this chap's CT scan, I've drawn arrows here, but you can see there's a huge amount of fat around his heart. His heart's in the middle here with the contrast in it, but where the arrows are pointing to, it's just fat, which is encasing his heart and preventing it from relaxing. And in fact, he already had the start of coronary artery disease seen on these cross sections of his left mainstem coronary artery with some calcification on the top. He's already started narrowing the most important blood vessel to his heart. So in this setting, we need to tell people to stop eating poor choices of food, so carbonated drinks, refined sugars, artificial foods or processed foods. I call that crap. You know, the slide has got some evidence of that on there. But we should also stop endorsing that, you know, nationally with regard to bans on food advertising in the way that these things are thrust upon us. The next slide is a pretty poignant one that might take some time to go over, but if you combine positive calorific balance and unhealthy nutrition with a sedentary lifestyle and genetic predispositions as well as environmental predispositions, you start a very difficult cascade, which is summarized in these slides, where you get impaired fat cell health, basically. You max out the fat cell ability in your subcutaneous elements, and you don't know what your fat cell capability is. Nobody does. But very likely that those fat cell tissues become unable to accept more energy. So there's no more room at the fat cell motel. And that tends to lead to a whole host of issues with regard to your body becoming inflamed and generally fat starting to lay down on your organs, so your liver, your heart, your pancreas, your guts, your kidneys. It's very, very pathogenic. And ultimately, it leads to your arteries becoming narrowed and the onset of heart disease. If we look at the next slide, this is an excellent infographic taken from Stahl EP and Journal of American College of Cardiology, showing what happens when someone has fatty liver disease and how that increases the risk of cardiovascular disease. Now, if you've seen any of the Fixing Dad or Fixing Us programs, you'll see that people are actively trying to reduce the fat in their liver, and that this is possible with diet and exercise. And if you take a moment to look at what happens in the body when you're starting to lay down visceral fat, it is basically a cascade or a slide towards metabolic disharmony, inflammation, and both cardiovascular, liver, and renal disease. If you get to that point where you're laying down fat on your heart, you are lining the heart with inflammation. That's the basic tenet here, and it's the inflammation that causes the reaction within the blood vessels that leads to them thickening and becoming inflamed themselves, and that's what leads to the narrowing, which ultimately will lead to potentially a heart attack if that narrowing becomes unstable. And that's why people need stents and bypasses to bail them out, and that's on this slide, saying that we tend to pick up the patients at that point where they need something doing, but we could have had an impact way back earlier in the process, maybe 20 years earlier in some cases, where education and lifestyle interventions could have prevented this from happening. And this is a schematic diagram of what's happening inside a coronary artery, where the perivascular adipose tissue would normally keep the vessel healthy, and the vessel would keep the adipose tissue healthy. But we get into a situation where everything is in mayhem and the artery is building up and narrowing, and then we get the heart attacks. So I would say that in trying to prevent the path to causing heart disease, or heartbreak as we've called it, you first have to tackle the fact that you may be becoming insulin resistant or hyperinsulinemic. And how do we get you out of that situation? Well, we get you out of that by recognising that you've got a waist circumference to height issue, that you may be becoming over fat. And how do you minimise insulin resistance? Well, you maximise the nutrient density of your food. You minimise the glycemic impact of your food. You keep the insulin levels pulsatile by avoiding snacking and consolidating your calories into larger infrequent meals. And you do high intensity exercise where possible. So obviously, Geoff took up cycling. If we look at patients who've had coronary artery disease, we know that when they pitch up for the rehabilitation, that actually only less than a third have normal blood sugar. And the rest may have thought, 1/3 may have come in saying they were diabetic, but we find roughly another third who are diabetic but didn't know about it. So in total, there are 72% of those patients who have what we'd call dysglycemia. And all it takes to change that paradigm is to give people good advice about the food they eat. You see here a slide showing someone monitoring their subcutaneous blood glucose levels with a Freestyle Libre, and you can see that within the space of 14 days, someone goes from having no time in target range and spending a lot of time with high blood glucose to having 100% time in range. And that only took 2 weeks with a Freestyle Libre to basically look at what foods they're consuming and nail their blood sugar down to the floor. So as I finish up, I would just say that improvements in cardiometabolic risk factors can be induced by regular exercise, and it has to be a combination of both in many cases to get the maximum benefit. And this is only moderate intensity exercise on as many days of the week as you can manage, and it's about taking baby steps. So I'll finish up with my alliteration, where I say, set Scotty's several sins, sending sickness sometime soon. So sugar sweetened beverages, smoking, saturated fat from processed sources, sitting, sedentation, sarcopenia, which is low muscle mass, slothliness, no regular exercise, sick fat that we've discussed, substantial starch and cereal intake, sandwich subculture, snacking, salad dodging for the Glaswegians amongst us, stress, sleep deprivation, sexual dysfunction. Many people don't know, but erectile dysfunction predates a heart attack by 3 years. So if this is happening, it's time to take action. Being alone and having depression, so solitude, sadness, and suffering also contributes to cardiovascular disease. So in summary, I think it's clear that we can take action here. We want to increase people's health span because people are living longer, but we don't want them living with disease. So I'm really grateful that Fixing Dad and AstraZeneca and Geoff and the boys have led the way to show how you can take action and how you can take back control your health. So thanks very much.
Thank you, Scott, and I want to thank you as well for your involvement. It's been fantastic. I know on more than one of our projects, but I think it really has brought this one to life. And I want to echo that, Graham, as well, just to thank you for making this possible, because we had obviously Fixing Dad, but this really threw another angle on it, and I think a lot more weight to the whole, the medical side of it, really, and just what the significance of it was. Everyone talks about how it was inspiring, but I don't think really everyone knew, just what Dad was avoiding by by doing all this. So it was. We talked a lot about the foot, but there were a lot of other organs in there that we hadn't really even, really thought about. I think in the back of our minds, obviously, we know these things are there, but this really has brought it to life. So thank you all.
No, more than welcome. And it's not just you, Anthony. I mean, we live and breathe this every day. As Scott will, and even last year, I know I mentioned that statistic earlier on of 18 million people per year. That when you take that 18 million people, 18 million deaths, sorry, per year, but when you take that into account, it's actually higher than all other causes of death combined. And I think in relative terms, the next to that is cancer and then road accidents. So it's a huge problem, and even for us at that, even when you look at it in that way, it was even a shock to us to realise actually the significance and the size of the problem at hand.
I think that's it, and I think obviously at this particular time, obviously there's so much going on, and people are often locked away and not able to do or be in the places they want to be. But a lot of people have said to us it's been quite a good time to focus on their health. So when we've actually worked with people, I guess that could be a positive thing that could come out of this if people chose to set a project for their health and just try and really focus. Because I think sometimes the stresses of work and being out and about, rushing around, it can make it even harder.
Yeah, I honestly think Scott's statement at the beginning of the film about that health is wealth just about sums it up for everybody, especially at the moment. I think everybody's looking at their health now. Everybody's realising they've had this great, terrible thing that's happening around, all around the world, and that if you haven't got that health, you've got nothing. You might as well give up now. And at the end of the day, I think that's the sort of message we need to get across. This is something that if you lose the health, you've got nothing. So you can start from a very early point. Any diagnosis of anything, just be aware that you can do something, and you are responsible. Only you.
Yeah, you didn't have that attitude right at the beginning, though, did you?
Oh, absolutely not. Absolutely not. But I want to scream at people now. I really do. Everybody I meet, I just want to get across that you are the person that can control this one way or the other. With the help of everybody around you, you can do it.
Brilliant. Probably a good place to finish. Thanks very much. Thanks everybody. Really appreciate your time.